Taking care of your well-being is strongly attached to how powerful your healthcare system is. Because at some point in your life, you're going to use it for one reason or another, whether that's a mild surgery, a medical consultation, a pregnancy follow-up, giving birth, taking medications, or even doing regular checkups when you're still healthy. And before I lose you here, with you thinking that improving your healthcare system is the responsibility of your government and policymakers in each healthcare facility, yet you can still do a lot. Yes, you. I totally agree that having the support of the government and policymakers is much more effective, but that's in our circle of concern. And one of the lessons I learned from reading The 7 Habits of Highly Effective People by Stephen R. Covey is that you should try maximize your circle of influence by transforming things from the circle of concern when you can. So, while we still hope that others play their role in improving our healthcare system, we still can influence things ourselves. We can have that under our control. And to be more specific, I'm talking about the human factors in the system: doctors, nurses, technicians, and the rest of the team, because they are the first line of defense in our battles with diseases. So today, I'm going to share with you 8 ways you can choose from to improve the healthcare system in your own country by supporting the essential pillars of it, its human force. If you're new here, this is Wellbeing Toolkit, helping you to integrate and upgrade your life by providing you with all the tools you need in one place. If you are interested, if you like having everything you need in one place, consider subscribing. This is one of the Aware Me videos I do in this channel, which is about highlighting important awareness days and campaigns to know about. This is my responsibility to you and others to share these messages and improve our world. And with you, we can be stronger. This video is in line with the World Health Day by the WHO, or the World Health Organization. This year, we celebrate the work of nurses and midwives and remind world leaders of the critical role they play in keeping the world healthy. They are at the forefront of COVID-19 battle, providing high-quality, respectful treatment and care, talking with others to address fears and questions, and in some cases, collecting data for clinical studies. Simply put, without them, there would be no response. If you're still wondering why you should care, how about improving universal health coverage, maternal and child health, infectious and non-communicable diseases, mental health, emergency preparedness and response, patient safety, and the delivery of integrated people-centered care? All of which you or someone you care about will need at some point in life. Still not convinced? Okay, how about nurses and midwives know the full picture of someone's health, and that helps improve care and saves money. They also know the traditions, cultures, and practices of their communities, making them indispensable during an outbreak or emergency. Investing more in midwives, who are critical for maternal and newborn health as well as for family planning, could prevent over 80% of all the maternal deaths, stillbirths, and neonatal deaths that occur today. Midwives' care from pregnancy to the end of postnatal period prevent almost a quarter of preterm births. And finally, there is a global shortage of healthcare workers, especially nurses and midwives, who represent more than 50% of the current shortage in healthcare workers. So right now, if you or anyone else are having problems in your healthcare facility, or you are not receiving the best care, it's because half the staff required isn't there. So if you are on board, then I'm glad to tell you that you are supporting nurses and midwives workforce to be strong enough to make sure that everyone, everywhere, gets the healthcare they need. So, how can you support them on this day forward? Well, here are 8 ways you can choose from. If you are a policymaker, you can invest in nursing and midwifery education and employment so universal health coverage becomes a reality everywhere. You can pay more attention to nursing and midwifery influencer leadership. Health services will improve as a result. You can take steps to improve gathering of workforce data in order to better target resources and make changes where they are needed most. If you are a healthcare worker, You can show your respect and appreciation for nurses, midwives, and other fellow health workers. You can listen to their views and explore their ideas. You can engage them in decision making. If you are neither a policymaker nor a healthcare worker, you still can call on local leaders to do more to support nurses and midwives and make investments that enable them to work to their full potential. You can spread the word and share this video with everyone you think need to see it. The more you share, the deeper you care, right? And most importantly, show nurses and midwives your appreciation for their work and thank them for what they do to keep you healthy. Thank them when they come to take your readings or give you medications or do labs or tests for you. Thanking them is a very powerful tool you have, and it doesn't cost you anything. On the contrary, you gain a lot in return. Those are the 8 ways you can choose from to improve your healthcare system, which your well being will depend on one day. And the more of those you can do, or the more of those you can influence, the better results you will have. That was it for today's video. I hope it added value to you. Let me know in the comments, what will you do today to enhance the healthcare system in your country? After all, it is the system that your well-being will depend on from time to time. If you like this video, consider subscribing and sharing it with others. And until we meet again, apply, achieve, integrate, and upgrade your life.